Good morning. Today's January 22nd, 2015. My name is Steve Maher, and welcome to our PSM RMP webinar series. This is part of Risk Management Professionals Outreach Program. And today, before we get started on today's topic, let's talk a little bit about how we're going to run the webinar. We do use a GoToWebinar interface. It provides a lot of flexibility for the audience. You have flexibility on your end to maneuver the video image that comes out as a default on the left-hand side. You can move it anywhere you want to. You can grab your mouse and resize it. You should be seeing a video image. You should be seeing a PowerPoint slide, and you should also be able to hear me, hopefully on the speakers on your computer. What we're going to do is go through a presentation today, myself, and I'll also be introducing Jordan Schultz. And after the presentation, we will have a question and answer session. The opportunity is provided for any of the participants to communicate with our producer, Alex, and he can be reached on your chat window. You can also call at our 877 number if you'd like to speak to somebody and they can pass a question over. Questions can be asked anonymously. Questions, if you'd like to, you can also be unmuted, and you can also join the discussion or post your question directly. Most people for these kind of presentations typically tend to do it anonymously. We will do that afterwards, but during the presentation, if you need to communicate with the producer or if you have technical problems, go ahead and feel free to use the chat window or call the number on your screen, 877-532-0806. So that should do it for logistics. Let's go ahead and get started. The topic for today is looking at the regulatory framework, the modernization programs that are being done by several agencies, and also the overall evolution of process safety management and risk management programs. We're going to be talking about initiatives at the federal level in the United States and also in the state of California. Myself, Steve Maher, will be kicking off with background, talking about the initiatives. Some of the specifics on two of the initiatives will be covered by Jordan Schultz. We'll close, and then we'll do a QA session. Just by way of introduction, Risk Management Professionals is hosting this. That's my employer. We are a process safety management consultancy with a couple of offices in the United States, and we run this outreach program to try to emulate best practices for a lot of the things that we do that include PSM and RMP support, and a lot of people call us in. A big bulk of our work is helping out with HAZOP and LOPA studies. The idea here is we offer these to help emulate best practices. We also provide an opportunity for people to be aware of things like what's going on in the regulatory climate right now. In terms of our approach, I'll start with talking about some of the key program elements of safety management systems programs, talk about how they're currently structured, some of the overlap. We'll talk about we'll identify the modernization and expansion initiatives, provide a little overview. Then we're going to talk about some of the key elements. Jordan will be going into a lot of details on two of the ones that we haven't already done webinars for. Our webinar series is ongoing, and some of these items, if you've tuned in the past, have been done in detail. These are all recorded. These are all available for free download. So where appropriate, we're just going to reference things that we've discussed already. You can download them. And we're going to try to focus on some of the new items. And also what we're going to try to do is provide some tips on what you should be doing right now. I'd like to go ahead and identify exactly what the status of the programs, all these initiatives are, and tips for how to manage your efforts right now. What's coming up? What should I be doing now, basically? Then we'll open it up for a question and answer. So let's talk about right now the safety management systems. What are they? Talk about some of the key program elements and some of the overlap. I always like to start with this slide because it's a good reminder to me for why we're here. Just about everybody, I'm sure, who's tuned in, deals with highly hazardous materials facilities. Either you're the program coordinator, a key safety individual on site, you may be a regulatory person, or you may be a consultant like us. All of us are part of the team in terms of working together to try to prevent tragedies from happening. The potential is out there. Tragedies have occurred. All the jobs that we do, everybody's job who's tuned in here is very important, and I really like to emphasize that. And also, what's coming out of all those is there's always lessons learned. Some of them at the detailed level, some of them at very high levels. a lot of the events that really woke people up to safety management systems occurred in the early 80s. And when they took a look at those events, when they took a look at other things that were happening, it was a recognition that there were relatively simple precursors, fairly simple initiating events, and that the root causes were failure to maintain the design intent. It's designed a certain way to provide a certain safety margin. Somewhere along the way that safety margin became eroded and there became problems. And when you started looking at the root causes for that and the corrective actions, it was really safety culture and management systems as key ways of correcting that and making improvements. So that was really the platform for where all these programs came into being and how to move forward with corrections in that event. This timeline, I think, will be helpful for giving us a perspective on where we are right now and how we got here. After the Bhopal tragedy in 1984, industry groups, regulators got on board, and that's where you saw the development of process safety management and risk management programs in the United States. The Deepwater Horizon accident that occurred in 2010, that was kind of amplified the efforts for offshore facility safety in the United States. When you look at the Piper Alpha event that occurred in 1988, it really instigated the development of safety cases throughout the world and initially implemented in the United Kingdom. The interesting thing about all these is a couple of things. First of all, it was an unfortunate tragedy. People being the way they are tend to react to things. So it was terrible tragedies that really caused the development of a lot of these programs, and a lot of these programs were associated with the industry or location where the accident occurred. The other interesting thing is that as they evolved, they all developed similar characteristics, similar elements for safety management systems. We'll go over those in a few minutes. It really resulted in a lot of overlap. But that wasn't always the case. Along the way, there were other programs that came into being and were quite a bit different, and eventually everything did converge and settled on the environment that we have today with safety and environmental management systems for offshore facilities in the United States, safety cases throughout the world, and PSM and RMP for onshore facilities in the United States. I was really privileged to be involved early on in process safety. My efforts in these started in 1983, and I've been doing a HAZOP study since 1986. I was also on the CCPS Technical Steering Committee in the mid-'80s, and I watched the evolution of a lot of these programs. Also, a key program during the 1980s was in California, risk management and prevention programs. The RMPPs that were done at that time really helped a lot of California facilities over a period of about a decade, but were eventually superseded by what we know today as CalARP, or the California Accidental Release Prevention Program. So when we look at the environment today, there were a lot of other programs that came into being, but eventually there was convergence on a lot of the key elements that you know today. I'm going to skip this slide, and that are represented on this overlap drawing. When you look at the SEMS program, PSM, and RMP, there's really much more in common than not. In the green area, hazards analysis, contractor safety, management of change, incident investigation, operating procedures, all those things are common elements to all these programs because those are the things that people have focused on to try to manage the level of safety at their facility. So there have been a lot of different things that have been going on, but eventually things did converge, and this is the environment that we've got today. Now, this is what we've got. Things are changing, and that's going to be the focal point for the next area. And this table is also provided just for reference. So next thing I want to talk about is the current expansion and modernization initiatives for the different safety management system programs. When you look at the activities and the agencies involved now, you've really got two key things going on here. The Chemical Safety Board, the CSB, and the Interagency Refinery Working Group in California basically are agencies that are providing guidance and recommendations for what the enforcement and regulatory agencies are doing. The enforcement and regulatory agencies, federal OSHA, EPA, California OES, Office of Emergency Services, and CalOSHA, California Division of Occupational Safety and Health, are coming up with regulatory programs that are designed to address the recommendations that are coming out of the CSB and interagency working group agencies. So these are the CSB and IWG are really putting forth recommendations that are going to get followed through by the other agencies. EPA and OSHA at the federal level are looking at the revamp of their programs. CalOSHA in California has already put forth a draft update to its PSM regulation, and the Office of Emergency Service is currently working on a draft of an update to the CalARP program, or the California Accidental Release Prevention Program. So you should be aware that all these things are going on. They're all rooted in trying to modernize the programs and address what are perceived as deficiencies as evaluated by the CSB and the IWG. So 2013 and 2014 have been busy years, and 2015 is kicking off to be the same way. During that time period, Federal OSHA has developed a request for information where it's identified some of the key initiatives that it's thinking about and looking for feedback. The Federal EPA has also done the same thing. They did that last summer. In California, you've got the CalOSHA has put forth an initial draft in September and a second draft in October that's undergone comments and feedback, and we'll be reviewing both that and also the current changes to the CalARP program during Jordan's portion of the presentation. So let's talk about what some of those recommendations were for the initiatives that are being implemented by the regulatory agencies. The Chemical Safety Board put out two types of reports. One to address technical issues, the other to address regulatory issues. Its initial interim investigation report that came out in 2013 was really to focus on technical issues in the aftermath of the August 6, 2012 incident at the Richmond Refinery. The key recommendations and the key elements for that we have discussed before, and Risk Management Professionals has provided some guidance. I'll quickly review this again. One of the key things they wanted to do is look at safeguards and their effectiveness as applied for the process hazard analysis, looking at inherently safer system requirements. We've provided some tips on easily addressing that, and we've also put out technical papers on inherently safer systems analysis. And also with respect to safeguards effectiveness, for those of you who've tuned into our HAZOP webinar, our HAZOP facilitation webinar series, there's a lot of tips regarding the development of safeguards and how to validate their effectiveness during the PHA. Damage mechanism hazard reviews, we've discussed in the past. That was a key recommendation from CSB, and we've provided tips in the past on how to go about and infuse key DMR issues into the PHA at the individual scenario level, at the node level, and at the system level. Reporting of leading and lagging process safety indicators, another key item that was identified as a deficiency or improvement area by the CSB. That's also something, there are various guidebooks out there that's relatively easy to address in your current PSM program. And the CSB also recommended the establishment of a multi-agency process safety regulatory program for all California oil refineries. And I think that's where the interagency working group has been picking up that initiative and coming forth with its own recommendations. At the bottom of this slide, I've identified a hyperlink that can take you to our page where you can download our webinars. The ones that provide some tips and guidance for addressing these CSB recommendations, April 24th, June 17th, and August 19th in 2014. Those workshops will provide a lot of good background information if you'd like some tips on how to address these. That was the technical report. The regulatory report was put out in November. There was an interim version early last summer, and then the final was done on November 10th, 2014. And there's also going to be a public hearing to adopt that final report. Next week, we'll be providing you some links and we'll be identifying that to you and how to get some more information on that in an upcoming slide. For the regulatory report, they really had 5 recommendations. The first one was really to restructure the California process safety management regulations. The key elements of that were augmenting process hazard analysis to include the hierarchy of hazard control analysis, which basically looks at inherently safer systems. So if you were doing inherently safer systems analysis, the HCA is going to address a lot of those key elements. Damage mechanism reviews. We've talked about damage mechanism hazard reviews, and that was something that was identified earlier in the technical report. And also MOC triggering of the inherently safer systems analyses. The restructuring also included a recommendation for making sure that there's a review of the PHA by technically competent regulatory personnel, that the regulators also do PHA audits and inspections, utilization of minimum requirements for codes and standards, participation of the workforce, reporting of information to the public, and also implementation of how to deal with new and improved industry standards and practices. And there's also a item in there to address regulator funding. So that was the first recommendation in the regulatory report. The other four, one was focused on looking at the leading and lagging process safety indicators. That's something that was also identified in the CSB technical report. And then three of the recommendations were associated with regulator compensation and funding. I think the intent was to make sure the regulators had sufficient resources to do what they needed to do with respect to California, oversight of California PSM-covered refineries. The California Refinery Task Force recommendations, by the way, you're going to hear the word refinery a lot. A lot of these initiatives initially are focusing on refineries. However, this is something that could affect all facilities that are covered by PSM, RMP, or the equivalent California programs, as some of them are dealing initially with refineries, but at some point may roll out to other high-hazard facilities. So what is the California Refinery Task Force? What did that interagency group come up with? Well, in February 2014, they put together a summary report. The key actions that they were recommending was establishment of an interagency refinery task force, basically a continuation of what they were doing to provide guidance for the agencies that were regulating these facilities in California. Agency emergency response and preparedness, looking at refinery requirements for CalARP and PSM, implementation of inherently safer systems. If these are sounding familiar, a lot of this is endorsing what the CSB came up and providing additional insights and information for what to do for California facilities. Performing periodic safety culture assessments, conducting the damage mechanism hazard reviews. Again, we've provided some tips on how to do that effectively in previous webinars. Doing a root cause analysis after significant accidents or releases, explicitly accounting for human factors, and also making sure that there are methods to ensure the safeguards are effective in your PHA. Again, that should sound pretty familiar. There's also a recommendation for annual compliance audits, increased frequency of inspections by the different agencies in California. In California, you've got several state-level groups. You've also got groups that are regional or local, often centered on the fire agencies, and these are called Certified Unified Program Agencies, or CUPAs. Also, a triennial independent evaluation of people's RMP, agency enforcement capacity and reporting for refineries, community education, and also they wanted to look at several other things such as the leading and lagging indicators, worker and community involvement, and also looking at safety cases. When you tally all these up, the real key things that are going on from these recommendations from the Interagency Working Group and also from the Chemical Safety Board are manifesting themselves in the things that OSHA is looking at that they put forth in their request for information, that the EPA at the federal level is putting forth in their request for information, and also in the current draft regulation for PSM for refineries in California. CalOSHA has also is also one of the key things to be watching in terms of developments of changes in the regulations. So, what are these things? A lot of them, for those of you who have been following it, are familiar. What I try to do is tabulate them and identify the overlap and correlation with the different agencies and the initiatives that they're working on. So I'll highlight a couple of them. This table is really offered for your reference, and we'll be, like I said, we're committed to this business. We have been for over 20 years, and this is something that we're going to be following very closely and try to help summarize these and help everybody out in terms of understanding and how to best implement these items. When you look through the list, expanding coverage and requirements for reactivity hazards, that's pretty clear as something that was needed improvement. That's being addressed by OSHA and EPA. Updating the list of applicable chemicals and threshold quantities, also something that's going to be looked at the federal level. The management system elements, the risk-based process safety, measurements and metrics, and also some of the things that have come up recently for the safety and environmental management systems programs, such as stop work authority and increased employee participation. Those are all being picked up with these initiatives. Other things that kind of come up in terms of potential impacts, looking at mechanical integrity of any safety critical equipment. In our June webinar, we did provide some guidance on how to easily address that. That's also in both the EPA's and OSHA's RFI. Management of organizational changes is showing up everywhere. One of the things that has been identified is how do you track when an organization changes that reflects on your safety culture and the capabilities of the organization. So all agencies are picking that up. That's something that is going to have to be addressed. It could be a little complicated. It could be very difficult to follow, but it's going to have to be addressed at some point. Coordination of emergency planning with local emergency responders. That's really important. And also the requirement of third-party audits. We've commented on this before. There's various pros and cons for that, but that's something that both the EPA and OSHA were looking for information on. Infusing ammonium nitrate into the regulations, it's something that both Fed OSHA and Fed EPA are picking up for obvious reasons. Safer technology and alternatives analysis. This hierarchy of hazard control analysis is really the implementation of inherently safer systems assessments that we've given webinars before on, and we have put out technical papers, and that's something that has been a key topic for discussion. The HCA is a more programmatic approach for how to actually implement your inherently safer systems analysis. Emergency drills, of course, automated detection and monitoring was a key item that the EPA picked up on. Flip to the next slide. I'm just going to hit the highlights. You have this table for reference. The safety case regulatory model has come up several times. It's still in the EPA's RFI, but that hasn't been an undercurrent of changes for OSHA or CalOSHA. PHA recommendation closure timeline was a key issue. A lot of people have been concerned on monitoring the implementation of PHA recommendations in a timely fashion, so those are going to get a closer look-see. Damage mechanism hazard reviews, those specifically came up for the CSB and the IWG recommendations. We've had webinars on how to efficiently address those things during the PHA and how to use that PHA effort to dovetail with your other efforts at the plant site, such as positive material identification, corrosion control, and the testing that the corrosion experts at the plant site will do in the field. Safeguard protection analysis. This is the term that's being used for when you use LOPA or other techniques to look at the effectiveness of safeguards. And again, in previous webinars, specifically in the June one, we've identified some tips on how to do that effectively, integration of LOPA with HAZOP, and also structuring the safeguards in your HAZOP study as independent protection layers so it can easily dovetail to the SPA. And after Jordan speaks, I'm going to speak a little bit more about tips on how to do this effectively, which portions of this should you be doing now, and how much of it. Okay, contractor safety, obviously. Management of change and using MOC to trigger other analyses. That wasn't a big item at the federal level, but the CalOSHA revisions are being more specific on what kind of analyses they want as part of MOC. Incident investigation, of course, and also specific requirements for a root cause analysis. Process safety culture assessment should be fairly interesting. That's something else that's getting picked up by CalOSHA. And management of organizational change I've already discussed. So a lot of these things, there's a lot of things going on. It's pretty obvious that there are some differences in where the different agencies see their programs going. There have been, we've identified in previous webinars the OSHA RFI elements, the EPA RFI elements, and the sort of things that what might be coming up on the horizon for them. I'll talk more about timing for some of the implementation of some of these items and what might be on the horizon. Obviously, nothing's finalized yet, and a lot of these things aren't required at this time. There's really no need to do anything, but I'm going to try to provide some guidance in terms of what you can do now such that when these things are required, if you're on a tight timeline or have tight resources, what you can do now to minimize any impact later. But right now, I'd like to turn it over to Jordan Schultz. Jordan's going to talk about two programs that we haven't done in previous webinars, the recent promulgation of a relatively minor update to the CalARP program that doesn't reflect the anticipated updates that are being currently worked on that may come up over the next 12 to 18 months. He's also going to talk about the PSM implementation by CalOSHA for refineries in California. Right now, it was drafted on October 31st, and he's going to review the key elements of that draft and try to identify, put a perspective on that in terms of how that dovetails with your current program. So yeah, Jordan's a key part of our engineering team, and let me go ahead and welcome him.
As Steve had mentioned, my name is Jordan Schultz. I am an engineer here with Risk Management Professionals as well. I'm here, like you said, to talk about some of the minor updates to the CalARP system, and a lot of what I'll be talking about will be dealing with the Refinery initiative by CalOSHA. So we're going to start off with the CalARP amendments. General requirements that have changed. They've changed the public notice process. Initially, you were supposed to go ahead and tell the public this has been submitted for review and put that in the newspaper. Now they've removed that requirement and also changed the formal public requirement. Instead of only having to be able to put it in the newspaper, you can actually now put it out on the CUPA's website. Hazard assessments have changed. Alternative release scenarios are essentially what's really changed. This should reach a public receptor. Obviously, that's not always possible, but if it is possible, that's what you should be modeling this off of. Also, those alternative release scenarios can be taken from industry experience. They've called out a few, but you can also go ahead and say, you know, in this publication, they talk about this, and use that as a basis. And obviously, as part of your 5-year cycle, you have to review the hazard assessment. Traditionally, this talks and requires some documentation. However, it's actually requiring this explicitly now. And then some minor changes to Program 1. Eligibility, it requires, quote, no public receptor exposure. Obviously, as part of being eligible for Program 1, you have to prove that your worst case scenario can't reach a public receptor. So this is kind of inherently built into the regulation, but it is something that still needs to be documented and shown that it's never happened, and this is why it never will happen. Also, you need to go ahead and, as part of your emergency prep, you need to actually have a site visit, make sure it's documented. And I put it under Program 1, but actually they've now started requiring that all programs submit an executive summary. Program 2 and Program 3 already require this. However, now you need to do it for Program 1. Changes to your hazard review or process hazard analysis. Obviously, the hazard review is based for Program 2, and the PHA is Program 3. In Program 2, your hazard review revalidation can only occur once between full hazard reviews. So you can do a full hazard review, you can revalidate and say, yes, this is all still true, but then after that, so basically every 10 years you need to be doing a full hazard review. Interestingly, in this new amendments, there wasn't a mention of a similar ruling for the PHA, so Program 3, that doesn't apply. It is a best practice to go ahead and do, so they still can probably push you to do that. Also, some joint requirements. They've now put some requirements on how you close out recommendations. Basically, they used to say in a timely manner. They've noticed and had quite a bit of problems doing some compliance auditing myself. That's obviously a big ticket item. They've now said basically either you coordinate how you're going to close these out with the CUPA, or you have 2.5 years after the PHA or hazard review. Also, next planned turnaround if that does require a turnaround. And then also you have to retain all your PHA, hazard review, and recommendation documentation for the life of the process. You initially could get rid of it after a little while, but now you have to keep it. Some various amendments. Your PSI for Program 3, ensure that PSI is maintained and kept up to date. This is also a best practice, but they're going to go ahead and require it just so that way it still can be regulated from. In addition to reactivity data that's required currently, you need to also document chemical compatibility data. So this is sort of them kind of expanding on the reactivity data, making sure that everything is covered. With regards to operating procedures, just ensure that SOPs reflect the current practices, and whenever they're inaccurate, you need to be updating these. Most facilities, you're doing at least an annual review, recertification that these SOPs are up to date and accurate. But basically, it also should be captured in your MOC process, but it's just going ahead and stating that to ensure that it's in as many places so that way you can't miss that one. Maintenance, Program 2, clarification. Basically, a lot of, especially smaller facilities, a lot of times you have maintenance that just kind of knows what they're doing, but you need to go ahead and make sure that those procedures and what they're doing, one, is documented, and that those procedures on how they're doing what they're doing are documented. It kind of also helps everyone be on the same page, both from the facility and make sure that regulators can come on site and make sure that what you're doing is adequate. And if you're using contractors, the owner has to ensure that the contractors are trained and qualified to be doing what they're there to do. Mechanical integrity, the maintenance sister program for Program 3, they called out some explicit devices, equipment, and things that they want covered. They added compressors in their drivers to the equipment that must be covered, and they clarified the ancillary components like valves are to be required and covered in the mechanical integrity program. Program 3, these are some that are only geared towards Program 3. Contractor updates, you got to document the evaluation of contractors. Essentially, it's always kind of required that you evaluate and make sure that they're performing both safely and they're doing their job correctly. Now you have to document that you have been making sure that the contractors are doing what they're doing. It puts a little bit more onus on the owner of the facility rather than just saying, oh, well, the contractors, they handle themselves. Their safety program is adequate for them. Now you're holding them to the same standard as yourself. Management of change updates clarified that you have to make sure that if you're doing new things that are going to change your operating procedures or your maintenance, you have to make sure that those are updated. This, like I said, kind of dovetails against making sure that operating procedures are up to date and accurate. And also, if you're changing your mechanical integrity, those changes have to be updated before you start that machine back up. And then also PSSR clarified that it's supposed to be used as a verification check independent of the MOC. A lot of times, obviously, you kind of have the MOC/PSSR, and it's basically, in some cases, the procedures have sort of meshed, and now they're trying to say to make sure, no, the PSSR has always been developed kind of to make sure that MOC process went through well and that it's safe to start up before you do it, rather than both happening before it and then you just check boxes. They've also changed emergency response applicability. If you're a toxic facility, basically ensure that the stationary source is included in the city or county hazardous material area plans or the business plan programs. And both toxic and flammable chemical facilities document that response actions have been coordinated with the local fire or hazmat departments. This, once again, is kind of like the Program 1. Basically, don't just have an email that this is what's happened. They want you to make sure that qualified people have came on site. They know kind of where they're going. They have a facility, kind of the general layout, so in case something does happen, they can quickly respond. They know people on a personal level. They also know how the facility is laid out, so that way they can get to things they need to effectively and try and mitigate as much as possible, the worst case. And also, don't just you have to have written procedures to notify emergency responders. Obviously, most people already know who they need to contact, but just in case that person's not on site or anything like that, it's covering some bases to make sure that anyone knows at least if something has happened, who to call, and then those people know how to respond. And now we'll be moving towards the CalOSHA PSM for refineries. 8CCR 5189.1, obviously this is to reflect that it is a part of CalOSHA PSM, which is 8CCR 5189. As Steve had mentioned, it was released initially for review on the 9th of September, and they've already received some comments and done some initial updating to it on the 31st of October. This should kind of point out how quickly they're trying to move in on this and get a lot of this stuff moving. Requirements that are specific to NAICS 32411, which is petroleum refining. As Steve had touched on, though, a lot of other facilities should be paying attention because these are things that could be established under general duty, best practices, and various other things, as well as it might be something they want to move towards in the future. Obviously, it's a significant change. There are 21 elements as opposed to the usual 14 from CalOSHA. There's 13 existing elements. They've updated almost all of these elements, and some of them are pretty significant. As Steve touched on, root cause analysis is now required for incident investigation. Trade secrets is actually the 14th that is missing, but there are 8 new elements, and these are what I'll primarily be focusing on. You've got the damage mechanism review, hierarchy of hazard control analysis, and safeguard protection analysis. This is kind of going to dovetail into the PHA cycle. Also, some other things that have been called for by the CSB and California's responded to, process safety culture assessments, human factors, and management of organizational change. This has been especially a hot ticket one for the CSB. They've been calling for this since Texas City. Also, this comes into some of them with risk-based process safety by CCPS, the PSM Management System, human factors, and then also one that wasn't really explicitly called for is access to documents and information. This was added during the 31st. It kind of deals with part of your PSM management system and part of employee participation that's been existing. So changes to some of the existing elements. Your PSI, basically, you've always been required to do PSI compilation before the PHA and make sure that everything's up to date. So people doing your process hazard analysis have the most up-to-date and accurate information. Now, obviously, since some of these other things are coming into your PHA cycle, they also have, it basically just calls out that that has to be in place before your PHA, HCA, DMR, or SPA. So basically, that especially applies to your damage mechanism review. That should be occurring prior to your PHA because your, I'll touch on it later, but your PHA is going to have to account for some of those damage mechanism review recommendations. So it shouldn't be too much of an effect as long as you're keeping your PSI up to date, but it does explicitly call it out. One pretty significant change, toxicity information should include both acute and chronic hazards. A lot of times this is on your MSDS, but they call out more than just a few toxicity things. They're saying you have to have your NIOSH, recommended exposure limits, threshold limit values, and then CalOEHHAs, acute and 8-hour RELs. So also, you're supposed to document inconsistencies with RAGAGEP, and if your equipment isn't RAGAGEP or you don't have the documentation proving it, basically you need to document that this was designed, maintained, it's operated in a safe manner, and that it's in its intended purpose. And the PSI should be available to any affected employees. So process hazard analysis, this is a pretty significant change. Like we had been talking about, I kind of mentioned it earlier, the PHA must address damage mechanism review recommendations. So obviously this means damage mechanism review should occur pretty close to, but a little bit before the PHA. CalOSHA requires access to the report. This report should include findings from your HCAs, actions, and how you're scheduling and making sure that these are implemented. And the report must be available to affected personnel. So as part of this recommendation, you now have to perform the hierarchy of hazard control analysis for all PHA recommendations. And like CalARP, they've gone ahead and made sure instead of saying, in a timely manner, you now have explicit requirements, which is if it doesn't require a shutdown, you've got 2 years to do it. If it does require a shutdown, it has to be during your next scheduled turnaround. And anything that has the potential for death or serious physical harm should be implemented immediately. If your recommendation can't be implemented immediately, you should go ahead and put in some interim safeguards that reduce it to an acceptable level. I think they actually call it for equivalent. So, and then also, much like CalARP, your PHAs will be retained for the life of the process, and as part of that, you should keep the recommendations and how you resolve those recommendations. So initial PHAs must be completed within 3 years, and they also call out that you have to complete your PHA within a 6-month window from when it starts. Operating procedures have been changed. So emergency shutdown includes conditions, basically what triggers an emergency shutdown. Also includes some tasks that are required as part of these emergency operations. Basically, you have to make sure the equipment is shut down and depressurized. Isolate this, like if it's a vessel or a piping leak, it's isolated before employees are allowed to return to the area. Basically, you can't have employees in the area until you've gone ahead and completely eliminated the potential hazard. Also, you can have alternative procedures as long as the employer can demonstrate in writing that an equivalent level of protection has been applied. You know, if it's, say, a toxic leak, you have, you know, your respirators, everything is equipped, but generally it's going to be very much more on the onus to shut down and depressurize. Training, implement employee testing procedures. A lot of times this has been a big hot button one. You know, you have this training program, but you know, some people just check the box. It's making sure that you have a way of verifying that your employees have received the training and that they understood the training, which is the most important portion. Also, train employees on emergency shutdown and operations. This one's pretty basic. Basically, since they are adding new requirements there, they're making sure that the regulation is reflective of that. Compliance audits. Instead of retaining your most recent 2, now you're required to hold on to your most recent 3 compliance audits. And also, the employer must respond to recommendations. Basically, if you find deficiencies, you have to respond within 30 days of, you know, how we are deficient, what we're doing to resolve this. Contractors, you're already required to evaluate some of the mechanisms for contractor safety. Also look at how they're doing employee, basically your injury and illness. In California, you're required to have an injury and illness prevention program. You got to look at that as part of the safety performance. And information you have to pass on to your contractors about the hazards of the facility. They've changed some of that. You also have to disclose the potentials for loss of containment, hazardous materials that you could be exposed to, and high temperatures and pressures in some of the areas of the refinery. Develop written procedures for safe entry, presence, and exit at the facility. Contractors must inform the employer of unique hazards presented. Basically, if they're doing something, they have to go ahead and point out to the employer, hey, this is what we're doing. You know, here's what the potentials are. It's basically making more of a symbiotic relationship where the owner of the facility, they have to tell contractors what kind of hazards they're looking at. The contractor has to keep reporting back towards the owner-operator to make sure that they know the hazards involving some of the maintenance procedures. Also, the contractor must have their documentation for each employee's training. This is another best practice, but a lot of times it kind of falls through the cracks. You know, you've been using the contractors for a long time. They've always done great work, but they should be able to provide documentation on every employee to show that they are capable of doing whatever tasks they're doing, and you should have access to that information. So pre-startup safety reviews. You're supposed to conduct a PSSR subsequent to all turnaround work performed on a process. It's a pretty small line item, but it obviously has a very large implication, as everyone knows how large turnarounds can be at refineries. They've also done some fairly minor, basically upkeeping, you know, not just your construction, but also your maintenance and repair work performed is in accordance with design specifications. And ensure recommendations from your damage mechanism review, PHA, and hazard control analysis are completed prior to startup. Like I said, they've required that these things are closed down during the next turnaround. And part of your PSSR process, since you have to do this subsequent to all turnaround work, make a final check to make sure that all these PHA recommendations have been closed out. Your MOC process, this was actually removed during the 31st, but it's kind of gone back and forth. They're talking about implementing this during some of the new elements, making sure that everything has been accounted for. Mechanical integrity, retain descriptions and results for testing while you're recertifying tanks and things like that. Maintenance procedures include instructions. You're already required to have written maintenance procedures, but they're now saying and calling out explicitly that you should have these instructions that make sure you're doing those procedures in a safe manner. And the employer must ensure equipment is in accordance with the Mechanical Integrity Program and RAGAGEP as well. Hot work permitting, this is a pretty significant one, and you're going to have a very, very, very large file cabinet. But retain all hot work permits for the life of the unit, and you must also maintain and make sure your hot work permit procedure has been kept up to date. Emergency planning and response, they call it out, but there are no significant changes from what you already have during CalOSHA PSM. Incident investigation, root cause analysis. Like I said, this is a pretty significant one. You have to implement an effective root cause analysis for any incident investigation. And the team must include somebody with RCA experience and oversight. The team also, it calls out some things explicitly that you have to investigate underlying management system causes. Obviously, we've been talking about process, your safety culture assessments, human factors, things like that. So it's kind of covering and making sure that you're covering all of your elements. You're not just looking at what happened to the process, but how did this one slip through the cracks? And also review the HCA and DMR. Basically, was this called out? Did we catch this? Was there a deficiency in the way we did this? Do we need to review some things? And as part of the incident investigation, conduct a damage mechanism review, process hazard analysis, hierarchy of hazard control analysis, and safeguard protection analysis to make sure that everything is covered. Also, you can demonstrate that sometimes these things aren't going to be applicable. Like say if it's somebody did the operating procedure wrong, obviously your damage mechanism review might not be applicable, things like that. Develop recommendations. Like I said, when you're doing that, conduct all these things. Recommendations have the same implementation requirements as a PHA. Once again, 2 years for non-turnaround. Turnaround is the next turnaround that is planned. And if it's an immediate hazard, you need to go ahead and implement either interim safeguards or basically shut the system down and get that fixed. The timeline for the actual incident investigation, as usual, assemble a team within 48 hours. You have to develop an initial report that can be looked at within 90 days, and that final report has to come out within 6 months of the incident. Employee participation, you've heard quite a bit about it. It's obviously been a big hot button. Employees or representatives on committees shall be chosen by employees or representatives. It's a pretty basic one, but it does have some pretty significant implications. Employees or representatives are given access to all documentations and information in 5189.1. Something they've also kind of called for in the CSB, this is done by Bessie, EPA has been looking at as well, establish a stop work authority. All employees may refuse work based on safety or health concerns. All employees may recommend to the operator in charge that you shut down the unit for health and safety concerns. And the operator in charge of the unit may shut down an operation due to health and safety concerns. So this also obviously gives you the workers, the operations, a little bit more power. You don't have to call up to the superintendent of the area. If that operator in charge feels like it's unsafe, he can go ahead and proactively shut in. And implement an effective hazard reporting program. Employees may anonymously report hazards in writing. This one's obviously pretty big, and then it requires that employer to respond to whatever was submitted to them within 30 days. And it has to be addressed immediately, once again, if there is the potential for death or serious harm. And the employer must effectively document work refusals, reports of safety and health hazards, shutdown recommendations, and actual shutdowns. This is sort of in line with some of the RBPS stuff when we're talking about leading and lagging indicators. It's basically trying to make sure that you're seeing more and more in certain areas or less areas, so you know really where to try and figure out how you can solve some problems that your workers are seeing. The DMR, this damage mechanisms are required. They define them as mechanical, chemical, physical, or other process that results in equipment or material degradation. So first thing you're probably wondering, how does this work in? The DMR timing, prior to any PHA and changes that affect chemistry, metallurgy, or operating limits. Basically, so prior to any PHA, and then make sure this is accounted for during your MOC process. The initial one has to take place at the earliest of the following. it can't basically, if your next scheduled turnaround or your next PHA revalidation happened prior to this 3-year mark, that is the first one of those two things is what you do. And if those aren't, then you have to do it no later than 3 years from the effective date of 5189.1. And at minimum, you have to evaluate some of the following: mechanical loading failures, wear, corrosion, thermal-related failures, cracking, embrittlement. Like you said, basically anything mechanical, chemical, physical, or other processes that result in equipment or material degradation. Hierarchy of hazard control analysis. It's a way of ranking prevention and control measures. Steve's touched on this quite a bit, so I'll try and breeze through it a little bit. But basically, making sure that you do have things in place and that those are effective. First order inherent safety, it's going to prevent the accident. Second order inherent safety, it's reducing the severity or likelihood of an accident. Called out lower pressure is one thing that would be an equivalent. Basically, if you're operating at, say, a lower temperature and you're worried about things, maybe you're not going to get quite as violent of a release, or it's going to take longer to develop. And then the least is IPLs, safeguards, and they call out passive, active, and procedural. Obviously, your passive ones, like, say, making a double-walled tank. Active, your shutdowns, or procedural, where you're making sure, like, routine operator surveillance, things like that. Obviously, passive is the best, and procedural is the least robust. An HCA, it's conducted during the following: in conjunction with the PHA, while you're implementing PHA recommendations, during the MOC process, during incident investigation, and these also can be triggered by CalOSHA. If they see something that they don't like, they can trigger you to go ahead and do this again. This is continued. This is a pretty lengthy part of the regulation. Employers shall implement first and second order inherently safer measures unless feasible. Considered feasible if any of the following are met. Basically, you can't, if it's considered RAGAP, control techniques are achieved, or it's emerging, or the control techniques are required by recommended practices, you can't say it's not feasible. Basically, you can't say it's a cost-prohibitive measure. Refinery manager shall sign all HCA reports, submit to CalOSHA within 30 days. CalOSHA can kind of require you and basically say you didn't do it correctly. Here are a few ways that they can say to do it again. Your process safety culture assessments, they should address basically some of your best practices. Encouraging that you're reporting things that you see that aren't right. Rewards aren't discouraging you from reporting these things. Ensuring that safety isn't compromised by production. Leadership, all the way down to from the top to the bottom, they're really embracing process safety, and that you have a robust human factors program. It has to include the following elements. How did you assess that? What did you find? What was the rationale behind these conclusions? How can we close out some of these deficiencies we found? And the report is to be completed within 90 days, and it has to be signed off by the refinery manager. Human factors to be included for all PSM elements. There are quite a few requirements right there. I'm not going to read them all off to you, but basically it's trying to cover some of those things that can't really be explicitly accounted for during some of the regulatory things, but you need to be looking at. Also implement human factor controls on process equipment, things like error-proof mechanisms, automatic alerts, automatic shutdowns, basically taking some of the onus off of having great operators. You also need to be keeping some of those things in mind. And ensure employees are involved in development. Management of organizational change. This is one of them that is, like I said, been called for by the CSB quite a bit over the last few years. California is trying to implement it. MOC procedures for organizational changes. Basically, you can have adverse safety effects because you're changing personnel, say you're downstaffing, or you're replacing somebody that knew the whole process front and back versus with somebody that doesn't have the experience at that particular refinery. You need to go ahead and make sure that you're not going to have any gaps in your safety. Safeguard protection analysis, or SPA, quantitative or semi-quantitative assessment for overall effectiveness of all measures and safeguards in an integrated unit. Once again, passive, active, or procedural safeguards. You're basically having to look at, are these effective? Combined with each other, are they effective to make sure that some of the PHA hazards have been called out? And do we need to put anything else? Are there inherently safe measures that we could be implementing instead? The report has to be completed within 60 days of the safeguard protection analysis completion, and the report can be standalone or actually enveloped as part of the PHASCA. Steve had mentioned it. Like I said, this is basically some of the things that are encompassed by LOPA. If you're doing these things in a proper PHA, a lot of times this is going to be inherently enveloped by the PHA-HCA actions. A PSM management system, basically the first and foremost, the refinery manager is responsible directly for compliance. Develop annual goals to achieve continuous improvement in all subsections. Track and document all changes to the PSM program. Also developing a PSM management system. Originally they were talking about a PSM management system team, but they've put their onus on refinery managers or his direct designee. Basically, develop roles and responsibilities and an org chart on who is responsible for each subsection and making sure that those things remain implemented. Ensuring effective exchange and tracking of safety, operations, and maintenance information. Once again, make sure you can anonymously submit hazards, and communication between employees and management, making sure that everything is as synced up as possible. And the last one, this is a pretty small one, and once again, it was kind of covered under employee participation, but the employer shall provide all documents or information developed or collected pursuant to 5189.1 to CalOSHA as well as the employees and their representatives upon request. So I'm going to bring Steve back up. He talked about it earlier. He's going to finish this out, and then we'll open up for some questions and answers.
What I'd like to do in this last segment is talk about what the status is of the different agencies involved, the various work products, and also if you're responsible for PSM or RMP at a facility, what should I be doing right now? Okay, that was not good. There we go. That's the right button. All right, so what do you expect? The CSB, as I mentioned before, is holding a public meeting to ratify the final regulatory report. It's currently scheduled for January 28th, 6 p.m. Pacific Standard Time in Richmond. I've provided 2 links. The details haven't been identified yet. I think they have done live streaming before. For previous ones, I would expect that to be lined up this time too. And I've provided a couple of links for information. The details for how to log in or attend have not been identified yet. The Interagency Working Group is continuing to meet and work together to provide comments on the different regulatory regulations that are coming out. However, they're not planning currently to provide additional reports or recommendations. At the federal level, the EPA is currently processing the comments they received on the request for information. They have not yet generated draft regulations that have been put out for comment yet. The federal OSHA is in the same status. They're currently digesting the feedback from their 2014 request for information. Those comments are being processed and regulations have not been generated yet. So at the federal level, things are still moving forward. It's going to be quite some time before you see draft regulations or a specific thing that you've got to respond to. In California, CalOSHA has put forth a separate process safety management guidance for refineries. That's been drafted. Jordan identified that one was issued in September, the other on October 31st. The October draft and its comments are currently being processed. The final regulation may go through another iteration. That's not clear. But in any case, it's scheduled, maybe scheduled for 2015. But if I were to guess, I wouldn't expect it to be on the books and a specific requirement until early 2016, either first or second quarter. Currently, the vision for CalOSHA is to have 2 separate regulations. As Jordan mentioned, the existing 5189 is going to apply to everybody that doesn't have an NAICS code that's associated with a petroleum refinery. If you're a petroleum refinery, you've got a separate 5189.1 document that is available for download either right from the CalOSHA site or from that web page that I identified earlier that Risk Management Professionals is maintaining. You can also download a copy there. Currently, there's no mechanism for synchronizing these requirements with either the federal OSHA requirements for PSM or for the California Accidental Release Prevention Program that's being promulgated by OES. So let's talk about that. The overview that Jordan gave you for CalARP was associated with the minor update that became promulgated and effective January 1st, 2015. In the planning process is a more significant update to address CSB and IWG comments, and right now the agencies are working together to try to harmonize it as much as possible between the two programs. So there's going to be another update. What it's the exact timing or what it's exactly going to look like is not clear. The current vision is that it will be a single document, a single regulation that applies to all California facilities that are encompassed by the CalARP program. So in California, you're going to have 2 regulations for PSM and 1 for CalARP is the current vision and where things are moving towards. For the CalARP regulation, 1 document and with separate requirements for what are going to be categorized as high hazard facilities, initially assigned an NAICS code associated with petroleum refineries. Also, there's no current mechanism for synchronizing that with federal RMP requirements or the Cal-OSHA PSM requirements that are going to be in the 2 documents. I think I got all that right. All right, so the real question is, what should I be doing now? At this point, there's no requirement to be addressing, there's no regulatory requirement or legal requirement to address any of these new documents except for the minor CalARP update that was promulgated on January 1st. However, everybody, including risk management professionals, is recommending that this be monitored carefully, keep a close eye on it, because there are things called best practices and general duty. There are also, a lot of these changes aren't going to affect just refineries, and also not just refineries in California. Eventually, there's got to be some synchronization where the different programs start moving together. For right now, what we would recommend for California CalARP covered facilities, that's all of them, is basically, obviously you've got to adhere to the new January 1st requirements. That's legal, that's regulatory driven, it's on the books. You should be aware of what's going on in the in California PSM updates for refineries. These are things you want to look at for best practices, because if you're a high hazard facility, you'll want to be aware of things that may be coming down the road, and also what are best practices as people apply them to things that can cause significant injury to personnel or to the public. If you're a CalARP covered and CalARP PSM covered petroleum processing facility in California, generally refineries, although sometimes, depending on your NAICS code, there can be some gray areas in going through those. Obviously, you have to adhere to the new January 1st requirements. And basically, risk management professionals' recommendation would also echo what some of the regulators are also saying, is to begin applying at least the high-value items, the high-priority changes that are obviously going to come up. If you see them coming up in CSB, IWG, and in the draft Cal-OSHA guidelines, at some point, I would say it's highly likely that those are going to get implemented and become regulatory requirements. If you start applying them now in a sensible fashion, and as I mentioned before, our previous webinars have provided lots of tips on how to do those effectively and to blend them into your current elements. If you start applying them now, you're going to be making a lot of progress. You're going to be doing the important stuff consistent with best practices and general duty. And when these regulations are actually promulgated, if it's anything like in the past, they're going to be promulgated with a fairly near-term deadline. With near-term deadlines, if everybody's trying to do the same thing at once, resources could be kind of tight. If you've got a lot of your program done, the regulators are going to give a lot of allowance to grandfathering the efforts that you've done as having met the spirit of the new requirements and really addressed the key issues. So the key recommendation is don't wait. Start doing the things that make sense and are actually high-value items that really contribute to your safety program. If you're not in California, if you're a United States PSM or RMP covered petroleum processing facility, you should definitely be aware of what's going on here. From a general duty clause, from a best practice issue, you should be aware of that and have some justification for why those things don't need to be applied at your facility. Again, that's just to cover your rear. All right, so what kind of resources are out there? We have put together, as part of our HAZOP facilitation series, there's a link that's offered here for our webinar page where all these can be downloaded. I've also provided a link on the 12th slide, I believe it's the bottom of page 6 of your handout, a link for our regulatory tracking page where we're looking at these evolving guidelines. You can download these items and keep abreast of the situation as it's evolving. But if you look at our module 10 of our webinar, we did go through mechanisms for integration of damage mechanism reviews into your PHA process. That's not the whole story, as I mentioned before. There are other things that need to be done for DMR, but a lot of the key things can be done as part of your PHA, which can act as a framework for making sure that the DMR gets properly implemented. Safeguards effectiveness, basically that's part of Safeguard Protection Analysis, or SPA, and I've provided the citation for the draft CalOSHA PSM for refinery regulation. That's also was something that we identified ways that you can fold that right into a good quality PHA. PHA action item completion status, revalidation were discussed also during that module, and also inherently safer design assessments that are basically part of your HCA as defined in the new 5189.1 section L. That's also something that can be readily addressed and framed out as part of your PHA. So the bottom line is there's lots of things that you can be doing that make sense, that can minimize the impact later, but I do want to emphasize there's no requirement legally to be addressing these at this time, except for the CalARP implemented item. The only sensible thing is doing the stuff on your site that provides high value. And I guess in terms of guidance, this is a moving target. It'll be evolving over time. There'll be updates over the next few months. We're going to keep you abreast of that via our webinar series, our outreach program. I've listed some of the ones that are coming up. The ammonia refrigeration facilities is of general interest for U.S. and California RMP and PSM programs. On March 5th, we're going to have a webinar specifically on the DMR, HCA, SPA programs and how to use PHA as a framework for that. A little bit more depth, and we're going to build on Module 10 of our HAZOP webinar series. We're going to also provide some tips on effective implementation. A lot of people call us for HAZOP and LOPA throughout the world, and how do you do that effectively long distance so you can keep your program moving. And we feel that April 22nd might be a good timing for another regulatory update that identifies the current developments at that time. And if that date needs to be changed because of other developments, we'll be doing that just to try to keep people informed. So I think I'd like to open it up for questions. Jordan's going to come up and join me, and what we can do is go ahead and try to address any of the items that have come to mind. Obviously, some of our guidance in terms of dealing with these evolving regulations is what we're recommending. As I mentioned before, there's no specific requirements other than the January 1st promulgation of CalARP. And some of where things are going obviously are speculative too. A lot of things could change. In the past, you've seen a lot of the regulations that have evolved and synchronized over time. Sometimes it's not all right away, but these things do come together over time. So I guess questions.
I guess this one's probably a little bit more in my ballpark. On contract evaluations, is that a pre-qualification or on-site evaluation? That's a good question. Actually, what it's going to be talking about more is on-site evaluation. It's making sure that basically you're periodically making sure your contractor is keeping track, making sure they're in line with your safety procedures at the facility. They're doing what is required of them in subsection C for that item. It's basically, are they working safely? Are they keeping their employees trained? Have they documented this training? And things like that. So the pre-qual is part of basically how you accept the bid, and this on-site contractor evaluation is basically to make sure that they're keeping up their end of the deal.
Do you want to start on this one?
Sure. DMR, damage mechanism review. So I kind of touched base on it a bit with the CalOSHA. It's a new requirement for the refineries. Basically what you're trying to do is look at various process things that can slowly damage your system. Like I said, corrosion, mechanical wear, some thermal stressing, making sure that you're kind of keeping track of some of these items and you're being proactive and addressing them before it becomes an issue. It's obviously been kind of pushed by the California Richmond Refinery was corrosion ended up breaking through a line in the crude unit, and it led to a pretty significant release and people going to the hospital. So this was largely because of a damage mechanism, and they're trying to make sure that you respond to them accordingly.
So I'll just add to that a little bit. This is basically the formalization of a program, a lot of programs that currently exist for well-managed facilities. Things that are that you're doing right now for positive material identification to identify what metallurgy and what alloys are being used for each piping segment and piece of equipment. Chemistry control within the facility, identifying what sort of corrosion mechanisms might be existing, and of course testing, making sure that you're testing in classically representative piping segments and elbows, but currently the trend is to have a mechanism. How are you going to catch all the different segments to make sure that it's the right metallurgy, that you're controlling corrosion, and that you're carefully monitoring the wall thicknesses and other characteristics to properly control and maintain that element of containment. For process hazard analysis, as I mentioned before in our June webinar, we did identify an approach where you can blend in the evaluation on a scenario-specific level, at the node level, and at the unit level for looking at various corrosion mechanisms and making sure that the programs are intact and identifying any potential outliers. You want to start on that one?
What is the hierarchy of hazard control analysis, and describe? Hierarchy of hazard control analysis, me and Steve have both kind of touched briefly on it. Basically what you're trying to do is make sure that the safeguards you have in place are doing what they need to be doing. It's kind of a promulgation of, your more quantitative risk-based analyses, making sure that, the level of safeguards you have in there are adequate for the scenario. They especially kind of bring up some of the inherently safe measures, whether it's changing your operating parameters or making the system just overscaled, and then also evaluating your IPLs. So basically you're just trying to make sure that all the safeguards are in place, they're independent, and then they make sure that you're fully covered for any scenario.
Do you want to take the next one? All right, the next one is, has 5189.1 been implemented? When would it be effective? Will it be expanded beyond refineries, and if so, when? So 5189 has been drafted. The initial draft was September 9th, 2014. The second draft was October 31st, 2014. It was put out for review. Comments were provided, and they're currently looking at appropriate updates. When will it be implemented? It's, of course, quite speculative. I think a lot of folks are looking for, they were shooting for summer 2015. It might get done by late 2015, but I think a better guess might be first or second quarter 2016 when it hits the streets, and you're actually required with an implementation date specified, of course, to go through and actually implement those key elements. CalARP, on the other hand, is going to try to harmonize with, my understanding, is going to try to harmonize with 5189.1. However, if 5189.1 doesn't move forward fast enough, CalOES and the other agencies are going to look for a independent draft of the CalARP updates that will encompass all facilities. 5189.1 is specific for refineries. That's actually within the title, Process Safety Management for Refineries. And at some point, after that gets implemented, and I guess they try it out, if there's a feel of a need to expand it beyond refineries, then OSHA will address that at the time. And next. Yeah, the next one's pretty easy. It's what does CCR 5189.1 mean? I take it that CCR stands for California Code of Regulations, correct? And that is correct. Basically, 8 CCR 5189 is the existing on the books requirements for implementation of PSM for California facilities that are covered by PSM. 5189.1 is just a separate document specifically for refineries. The current draft has all those additional elements that Jordan spoke about. Do you want to read that one? Do you want to take care of that?
Sure. We work for a client, an offshore oil and gas platform. How does this affect our operations? Obviously, the offshore, you've got to really worry quite a bit with BSCA SIMs, but I think the CalOSHA PSM for refineries is not going to apply to you. You're not going to be under the NAICS code 32411, so that won't apply to you. And I don't think the CalARP program applies to offshore facilities, but I'll kick that one over to you.
Okay, so the everything Jordan said is correct. There's no direct correlation. Right now, BSCA is responsible for administering that program, and there's been no move on in that area to expand SIMs to accommodate anything that's currently being proposed for California facilities. And I'll go ahead and start on the next one. Where do we find the summary of the January 1st CalARP changes? Jordan provided a very good summary. This particular this webinar will be available in download form within the next 48 hours. Is that fair, guys? Alex? Okay, yeah, I'm asking my producer just because they're going to have to do it. But this will be available for download within 48 hours. And the copy of the January 1st requirements can be downloaded from our regulatory tracking site. The next one says EPA website. Right. The next one is EPA website has the updated CalARP regs reflecting the changes. All right, so that's just a comment that provides some guidance. We're also going to provide a copy. And the next item, do you think OSHA will be successful in including oil and gas well drilling, servicing, and production facilities under their regulatory enforcement jurisdiction? That's a great question that would be highly speculative. I really can't answer that, to be honest with you. I really can't identify how hard they're going to push that or how successful they will be. Obviously, in the past, you've probably heard us identify that as part of the OSHA RFI topics when they came up. This is one of those areas that would have a very big impact on industry. And also, everybody understands that the oil and gas well drilling and servicing operations are usually in remote locations, very simple systems. So a lot of these key elements that deal with processing facilities and the various prevention program elements really aren't going to apply very well to oil and gas well drilling and servicing. So I'm not sure where that's going to go, to be honest with you. Right now, until something is done, I would go ahead and maintain safety margins, apply the elements of the program that make sense as part of best practices. Okay, next. Okay, the next question was, is LOPA required for RMP submittals to the EPA? As Jordan mentioned, this could be a key part of the SPA element in the new CalOSHA draft requirements. We apply layer of protection analysis. LOPA is layer of protection analysis. We apply layer of protection analysis as an offshoot to our HAZOP services. We facilitate those, and they're typically applied to help identify whether or not the existing safety features, or if you're designing a facility, the proposed safety features have sufficient reliability to properly protect the equipment and individuals for the scenarios of concern. So it is a very, very good tool, very well defined, and we use it a lot to help clients out. And yeah, it's not required for submittals at this time, but it's currently being absorbed into some of the CalOSHA proposals. Okay. The next is based on the OSHA request for information, the EPA request for information, and the Cal-OSHA draft PSM regulation. It seems like the agencies are moving in different directions. Where do you see this going, and is this functional? Obviously, this is speculative. It's not speculative. The agencies currently aren't synchronized. California agencies are trying to harmonize and have analogous regulations, but there's really no synchronization of efforts, and you can see that the OSHA RFI, EPA RFI, and the what's going on in California with CalOSHA, based on the drafts and the information that's out there, are really hitting different topics and are proposing different items. It's not unlike what was going on in the 1980s with risk management prevention programs. At that time, the CCPS and the API were providing key elements from the industry side. OSHA was cooking up its PSM reg, and then the EPA was also working in parallel and monitoring that and also developing their own regulations. Over time, these things did converge, but initially, in the 1980s, you did have a separate RMPP requirement for California and really no requirements elsewhere. So realistically, they are moving in different directions. At this time, it's going to be really rough on industry to try to get a grip on this. If these are promulgated as independent items, it's going to be difficult for the people at the plant sites to keep up with it. It's also going to be a very complex regulatory environment for the regulators, and so it's going to work, but it's not going to be very efficient, and it'll be functional to the extent that people can keep up with the complexity. It is complicated. Realistically, the regulatory environment and what we're trying to do as industry, consultants, and the regulators is really provide a safe environment at facilities for protection of equipment and protection of personnel in the environment. The simpler you can make the regulations so that it focuses on the important items, focuses people's energies on the things that will actually protect people, the environment, and the facility itself, really the better off everybody will be. So keeping things focused, keeping things synchronized is going to make it easy. I think in the regulatory environment, making it easy to implement is also conducive towards protecting everything. So I guess right now I don't see that happening initially. I do see some differences in where the agencies are going, but I guess I would encourage all the folks who are working on these different regulations to do their best to synchronize so that you've got one front of effort and something that's easily implemented so that people can focus on safety and really do their best at the plant site to protect everybody. It's a good goal. It's an objective. This point in time in January 2015 is the opportunity to pull these things together and have something that can be effectively implemented and really help everybody